Hello and welcome. Today we're diving deep into a serious and potentially life-threatening condition, bladder necrosis. This is where the tissue of the bladder dies, and understanding it is crucial for both awareness and potential intervention. So, what causes bladder necrosis? The primary culprit is often a lack of blood supply, known as ischemia. This can happen due to several reasons. Think of it like this: the bladder needs a constant stream of oxygen and nutrients to stay healthy. When that stream is interrupted, problems arise. Common causes include prolonged urinary retention causing overdistension of the bladder, which compresses the blood vessels, severe bladder infections that damage the bladder wall, radiation therapy to the pelvic region damaging the blood vessels, certain vascular diseases that narrow or block arteries, surgical complications during pelvic procedures that compromise blood flow, and rarely, tumors that obstruct blood supply to the bladder. Now let's understand how bladder necrosis actually happens. The process begins with a disruption of blood flow to the bladder wall. When the bladder cells are deprived of oxygen and nutrients, they start to undergo cellular stress. If the blood supply isn't restored quickly, this leads to cell injury and eventually cell death, or necrosis. The necrotic tissue becomes weakened and susceptible to infection, further complicating the situation. This dead tissue can also lead to bladder perforation, which is a hole in the bladder wall, allowing urine to leak into the surrounding tissues, causing severe peritonitis and sepsis. While bladder necrosis is a serious condition, it's thankfully relatively rare. Precise epidemiological data is limited, but it's known that individuals with risk factors, such as those undergoing pelvic radiation, having vascular disease, or experiencing prolonged urinary retention, are more susceptible. Certain populations with higher rates of underlying vascular problems may also be at increased risk. The prevalence can also vary depending on geographic location and access to prompt medical care for conditions that can lead to bladder ischemia. The signs and symptoms of bladder necrosis can be quite alarming. These might include severe abdominal or pelvic pain, blood in the urine, a decreased or absent urine output, fever and chills, signs of sepsis like rapid heart rate and low blood pressure, nausea and vomiting, and generalized weakness. It's important to remember that these symptoms can also be associated with other conditions. But if you experience any of them, especially in combination, seeking immediate medical attention is critical. Diagnosing bladder necrosis involves a combination of clinical evaluation, imaging studies, and sometimes direct visualization. A physical examination will assess for tenderness and signs of infection. Blood tests can help identify elevated white blood cell counts, indicating infection, and assess kidney function. Imaging techniques like a CT scan with contrast or MRI of the pelvis are crucial to visualize the bladder wall, assess blood flow, and identify any areas of necrosis or perforation. A cystoscopy, where a small camera is inserted into the bladder, allows for direct visualization of the bladder lining and can confirm the diagnosis. Biopsy of the bladder tissue can also be performed during cystoscopy to confirm necrosis under a microscope. Bladder necrosis doesn't have specific types in the traditional sense, but rather it is classified based on the extent of necrosis and the underlying cause. It can be described as partial or full thickness depending on how deeply the bladder wall is affected. It can also be categorized based on the etiology such as radiation-induced necrosis, ischemic necrosis due to vascular disease, or infectious necrosis secondary to severe bladder infection. Treatment for bladder necrosis is aggressive and focuses on removing the dead tissue, controlling infection, and restoring bladder function if possible. In many cases, surgical intervention is necessary. This may involve a partial or complete cystectomy, which is the surgical removal of part or all of the bladder. In cases of severe infection or perforation, diverting the urine flow through a suprapubic catheter or uterostomy might be necessary to allow the bladder to heal. Antibiotics are crucial to combat any infection. Supportive care, including fluid resuscitation and pain management, is also essential during the recovery process. In some cases, hyperbaric oxygen therapy may be used to promote healing by increasing oxygen delivery to the damaged tissues. Preventing bladder necrosis focuses on addressing the underlying risk factors. This includes managing vascular diseases through diet, exercise, and medication, preventing prolonged urinary retention by timely catheterization, or addressing bladder outlet obstruction. Carefully planning and delivering radiation therapy to minimize bladder damage, ensuring prompt treatment of bladder infections to prevent severe inflammation and ischemia, and meticulous surgical technique during pelvic procedures to avoid compromising blood flow to the bladder. The prognosis for bladder necrosis depends heavily on the extent of the necrosis, the underlying cause, and the individual's overall health. Early diagnosis and aggressive treatment improve the chances of a positive outcome. In some cases, complete bladder removal may be necessary, which can significantly impact quality of life, requiring urinary diversion. However, with appropriate management, patients can often lead fulfilling lives. Research continues to explore new methods to improve blood flow to the bladder, minimize radiation damage, and develop less invasive surgical techniques for bladder repair and reconstruction.